Hi, this is a long time
Hi,
difference from us. You're in San
I
Francisco, I'm in
know.
Abu Dhabi.
Yes.
It's
Yes.
great to see you.
It's yeah, you too.
I like your hair. Did you do
Um, I didn't do a lot. It was a curling iron and it was yesterday.
well,
I'll be
I
honest.
find it when I sleep on it, it looks better when I
Yeah,
do that.
yeah, sometimes it does. Yeah,
Yeah.
sometimes it does.
I've heard this new
So,
doing your hair before you go to bed thing. I saw an actress talking about it and I tried it once and it actually worked, but I'm too tired and lazy at night to
yeah,
do
I'm
my hair.
tired at night. I'm tired in the morning sometimes too. So,
Well,
this
we're
is what
tired
we
all the
get
time.
today.
We're
Yeah,
tired,
exactly.
right? Okay, off the top, I
Yeah.
became obsessed with you on Instagram. Usually want to share every single post that you write, but I think one of the things that I admire so much about you, you are the only voice that I've seen on social media talking about the problems with the for-profit healthcare system in the US, talking about the problem with regulation, talking about all of that and how it's impacting care of women and women of all ages. But we're talking, I deal with perimenopause and whatever. So
Yeah.
what, just off the top, when you see people talking, what do you think you want? What do you want people to know off the top about the way it's impacting us? Can you pick one thing?
I think, yeah, I think the biggest thing is just that we have to look at everything with an objective eye, and that the days of just trusting what our doctors tell us and trusting the guidelines are over. And I wish that more people were talking about that. I wish that more people were transparent. I wish the people that were in that space and the physicians that are in that system and the functional medicine doctors that have left that system have been very vocal about why. And I wish that we could get some commentary from the other side. I think that I tend to be a little bit more controversial for talking about those things. I get the unfollows and you know the mean DMs. And I just think it's important that we're talking about this, because if we don't talk about it, even though I'm part of it, if we don't talk about it, it never changes. And so I think that the for-profit system has been affecting women for years and years and years and years and years. And finally, we have more access to information and we're becoming more wise to it. We're asking more questions. We want to know alternatives. We know the conflict of interest between the FDA and the pharma companies, and that pharma funds the politicians, and where the guidelines come from. And I just think as women in general, not just as healthcare providers and men, we need to be asking more questions and we need to get better answers of where the data is coming from,
Right.
where the guidelines are coming from, and how those decisions are made for us.
So just in that FDA loop, because you hear this, the gold standard of the FDA, and there's, I see people all the time, like, I believe in science, I believe in fact-based. I see this all the time and I feel like saying,
Yeah.
oh, honey, so do I.
Yeah.
However, however,
Yes, we all believe in science.
yeah. Yeah.
Yeah.
First of
Yeah.
all, science isn't settled ever. Like,
No.
I get all the emails with the dozens of clinical study results that are going on around the world. I can't even keep up with those emails to read
No.
them. So that's
No.
just number one. That's just number
Right.
one. You say science and it's different than it was 2 seconds ago. But how about the
Absolutely.
FDA? Like you're you're in it. Like you're in sort of, can you explain to people who would have no idea what, from your understanding, is the problem?
Well, and it's hard because I don't know, did the chicken come before the egg?
Right.
I think it's this this trifecta between conventional medicine and big business. It's the health systems that own the doctors. The doctors don't even have these decisions. And primary care is this ginormous funnel that goes up the specialty tracks, and
Right.
that is where the money comes from. And then the FDA has to regulate everything. But when the FDA is controlled by the pharmaceutical companies and also the shareholders and the bottom line, that's going to decide what is and isn't studied
Mhm.
and how it's studied. And it takes money to do research. And so to say something is FDA approved and then certain medications are only FDA approved for certain indications. And
Right.
so, and then you have the pharmaceutical companies that are funding all of this. And so they kind of control. And it's not just pharma. So I don't want to paint, you know, this horrible picture. It's not the only thing. But when we look at the randomized control trials, what is being studied? I mean, this is the very reason women have not been studied. We don't have adequate research on hormones, perimenopause, menopause, medications, how women and heart disease is 110% different than that of men.
Right.
And up until now, we've been doing the same treatments. I mean, they didn't even start including women into the studies until the 90s.
Okay.
So if it takes 17 years for studies to hit practice, I mean, we're behind.
Right.
And that's why, I've worked in doctors' offices where we all have a very different approach to certain things. You know, there are guidelines and then there's how we all approach different things. So,
you mentioned, okay, something that's very important. I thought was you had a post and you said this doctor has come out and said this, and then you traced back and there's a place that you can look for where doctors are because doctors have to be transparent when they take money from pharmaceutical companies. And so you said, this doctor is recommending this thing. I can't remember what it was. And then you said, I went and searched, and they had made a significant amount of money and were being paid to essentially say that. And I don't know if people realize that, right? So where is it you can look? And
so I can't remember the name of the actual website, but if you Google, physician payout from pharmaceutical companies, it will come right up. It's very transparent. You can see this particular doctor was speaking out against hormone pellets, which I'm not promoting hormone pellets. I don't think there's a ton of data on it. I think it's a little inconsistent, and that's not really the point.
Hormone pellets are one of these incendiary topics though in our space, right? Hormone pellets, hormone therapy, compounding pharmacies. These are like the things that get people fired up.
Right. Yes. And I was just reading yesterday, this guy came out and he was a reputable MD, and he said, why are these guidelines so outdated? The compounding pharmacies are regulated by the FDA. They go in and they do everything they're supposed to do. It all comes down to money. Again, I mean, it comes down to money. Compounded medications are a lot less expensive than the FDA medications are.
Right. So, but people make it seem like compounding pharmacies, and I always compare it. They're like a meth lab, but they're not. They're pharmacies.
They absolutely do. No, they're not a meth lab. But you're right. They demonize them like nothing I've ever seen. I've used compounding pharmacies in my practice for a long, long, long time.
Okay.
We compound breast creams and we compound all kinds of treatments.
Okay.
We want something specific we know is going to work, or we've learned is going to work. And it's not, there's no life risk here. We use those things. So this is nothing new. As far as the pellets, it's a mode of delivery. I think where the problem comes in is when the people that are consuming this product are not fully aware of the risks going in, or the efficacy to say that these are superior to this.
Right.
Yeah.
And a lot of times, I mean, like there are always very bad results that can happen with almost any drug. Right. And many of the drugs that are being approved by the FDA end up having side effects that weren't known and come out later. And I think with the
and then they get recalled.
Yeah, and they get recalled. That happens all the time, and then you don't hear about it. So that pellet thing is certainly not for or against, but I just think that I see doctors all the time recommending them and talking about them, but then they're one of those things that someone else will say, walk away if someone ever mentions that they're a hack, they're and I don't know.
Right.
I mean, how do we even know? It's become so hysterical in this space, some of these discussions. I find progesterone cream is the same. Progesterone cream seems to be like, you're sort of heretical if you suggest that someone could use progesterone cream. And I understand why it's controversial, because you need progesterone to oppose estrogen if you have a uterus, and maybe the progesterone cream can't do that. But I saw, like Dr. Jen Gunter in her book says, you can't absorb progesterone cream through your skin. And far be it for me to challenge a doctor, but lots of things are absorbed through my skin, as you write about all the time.
Yeah, to say that it can't be absorbed, that I'm not familiar with why progesterone would be different than anything else. you put on your skin. I mean, estradiol can be applied to your skin.
Yeah.
We use it in patches, creams, anything. Yeah. There is that part could be controversial because progesterone cream cannot protect the uterus,
Right.
from too much estrogen. So,
Yeah.
yeah, I would have to look back and see what she said about that.
Anyway.
Yeah.
There is a lot going on behind the scenes that makes the care that women receive in the US and in other countries. It happens in Canada, it happens in the UK. There's a lot going on that people don't understand. You were talking before we started recording, say about something like vitamin D. Can you just explain that example? Like you were just talking all about it, and I thought it was
so, yeah. Well, what I said about vitamin, and that was an example of a medical guideline that is, in my opinion, outdated. We know that we need vitamin D. We know that low vitamin D levels correlate with breast cancer, depression. It plays a part in bone health, and a lot of us are deficient, and we wear a lot of sunscreen. We don't go outside. We know that a lot of women have vitamin D deficiency.
Right.
But it's not a recommended screening. So when counseling my patients, I have to say, I recommend that your vitamin D get checked, but it may not be covered by your insurance because it's not necessarily a recommended screening test. And the reason for that is because if the government comes out, the United States Task Force, and says, like, we have to screen people for vitamin D related to this, this, and this, because now we have adequate evidence, then they have to also pay for it. And I think a lot of that is what guides our system from not recommending certain screenings, even though we know it's important. We have the data.
Yeah.
But it just hasn't reached that guideline. And I feel like some of that is a lot of where healthcare is changing.
Yeah.
And so people looking at more recent data versus people practicing in a more conventional insurance-based model, they're driven by the insurance. Their hands are tied by insurance. And so it's creating this turf war between conventional medicine and functional medicine, which is unfortunate because I feel like finding a happy medium between the two could be really beneficial for our healthcare system, because it's so focused on prevention, but I think too, that's the issue with functional medicine and these people, more integrative medicine, lifestyle, that can get people to these more optimal levels and maybe more efficiently, but it's not covered by insurance. And so then we forget this whole subset of people that can't afford it. And that's where it's become polarizing, just like everything else in this country.
Yeah. And vitamin D is one of those things that affects our whole health. I know the UAE, where I am, is one of the few governments that came out and said in COVID, make sure your vitamin D levels are high. Not very many governments came out and said that. Now they have a whole expat population doing private insurance and often paying, but I thought it was interesting that they said it. Not that I want to wade into that whole debate, but it's just an example. And functional levels are always higher or lower, right? Like than conventional medicine. So you could go to conventional medicine and have a test for, say, inflammation, and they say your inflammation is fine. And then you could go to a functional person and they'd say, well, actually, we want it down here. Like they have.
Yeah. And as far as even like your inflammatory markers, like your C-reactive protein is a huge marker for inflammation. And we know that inflammation causes disease. And we know that women in middle age with lack of anti-inflammatory hormones have more inflammation, but we aren't screening for that test. We aren't doing it. It's not routine unless someone has some pretty significant symptoms, like severe joint pain. And by the time they get that test, they're all the way to rheumatology at that point.
Right.
Because we aren't testing it. It's not even taught to look at it. And so, to get those tests, you're going to see someone more specialized. You're going to see a functional medicine doctor. It's not going to be in your routine primary care office. And that's where I feel like we are not teaching people how to be well. We're teaching them how to be sick. And the people that are getting attacked by conventional medicine because there's a huge shift going on. And so, and a lot of them, I think they're trapped in insurance-based systems. And so a lot of it has to do with the business behind it. And I don't want to pretend too that functional medicine people don't have a business model sitting behind why they do the things they do. So I don't want to confuse that, because It's all financially driven, every bit of it, because we have to make a living.
Yeah.
But I think that's where the transparency comes in with people, to be able to say to your patients, this is where my hands are tied. This is why they're tied,
Right.
and this is what I might recommend if they weren't. Or I
Yeah.
think there could be a really good happy medium between the two if
Yeah.
people could just get along.
Right. I
And,
mean, yeah, it's the word alternative and the word complementary. Like it doesn't have to be either or, but I don't know.
yep.
That's why you're so interesting, because you're in the medical system, but you're so open to all of it. How did you get to this place? Like,
I think that's why I share a lot about my Enneagram, because I do, being an Enneagram 8, I can't keep it to myself. It's this, this justice for people when I'm working in the system and I'm seeing it. I'm literally seeing day after day how I don't have the tools to help these people. I don't have it. They're looking for it. And where sometimes these things will work and sometimes they won't. And I think getting on Instagram and say, when I started my page, I was like, oh, okay, this is wits and wellness. And I'm going to talk about how, science rules and this is what matters. And there are guidelines in place. And then I'm like, the people have spoken. They're pissed off. They have good reason to be, and starting to look at that and seeing then too the polarization, even amongst people on Instagram. I mean, it's
what do you see?
people
What
that
do you
are
think? From where you're sitting, what do you think the biggest issues are?
I think it's a lot of discrediting of people's experiences, their personal experiences, their healthcare experiences, experience in general. I mean, I've been in healthcare for 20 years. I could sit and tell you an 8-hour podcast of stories you would not believe that people don't talk about that happen. And
Okay.
it's, it has to do. And so the more I think you see, the more jaded you get too. And my own personal experiences with my family and dealing with a for-profit system, and those things. I'm losing track of even what we were talking about, but I think that's the biggest problem. People are there to discredit other people, and they're also, the way that they do it, they write these complicated posts. For example, estrogen dominance.
Yep.
Well, estrogen dominance isn't real. Okay, well, as a consumer and someone that's not medically trained, what does that tell me? So all these people have been lying to me.
Right.
Well, that's actually not true either, because we can say estrogen dominance is not a medical term. That's fine. There are conditions like PCOS and perimenopause where estrogen levels are high.
Yep.
And women experience symptoms due to high estrogen. And
Right.
there are ways through increasing dietary fiber, you don't need a big detox, and balancing with progesterone to rid yourself of the symptoms of estrogen dominance
Right.
or just high estrogen. We know that in perimenopause, estrogen levels can be 30% higher than any other time, but it can be at any given time in the cycle. But why are we hashing out, medical term versus this or that? It's all to discredit other people,
Right. And then
as much as it is to educate. But
it's very disheartening when you see a doctor saying, one of the myths of menopause, what are, and pointing and music's going, and you're like,
right.
but I know
Yes.
someone who had that, I had that, and now you're calling me, one is adrenal exhaustion. Okay, fine. Maybe it's not a term, but
Don't
something
call it that.
definitely happened to me in my early 40s. And I
Right.
was definitely helped by a naturopath. My eyelashes fell out. I felt horrible. I couldn't sleep.
Right.
And so when I see a doctor like pew-pewing and saying that didn't happen to me, I find that crazy. And so this is what you're saying.
Well, that's exactly what I'm saying. And even worse, when the Endocrine Society publishes a paper on adrenal fatigue, I don't care what you call it. Don't call it that.
Right.
Call it, HPA axis dysfunction. We know our adrenals react to stress, right? And it causes this cascade. This doctor in the article referred to it as the couch potato syndrome, saying these people just need to get up and, move. And, the people who don't do enough syndrome, he also said.
Nice.
That is the attitude people get when they go in for these problems. They read about adrenal fatigue online. They come in and say, I think I have it, and they do state in the article, they need to listen to people. To me, that is condescending
Mhm.
and not empathetic at all to
Right.
say someone has couch potato disease. These people could be working 3 jobs, and that's why their adrenals are pumping out cortisol,
Yeah.
to the point of exhaustion, and not because they're sitting around doing nothing. Maybe they
No,
don't have the same luxuries. And so
I
I
was
find that
going to,
just to be very
I,
condescending.
sorry, I was going to spinning like 6 times a week because I was so anxious. I was going
Right.
to spinning and
Right.
doing yoga. Like it was not
Yeah.
laziness, but, um,
Yeah.
and so estrogen dominance, like, yeah. So everyone on social media gets hung up on this term because it's not recognized by an official body, right? But it is
Yeah.
describing a situation that is happening in people's bodies. So stop focusing on the term. That's
Yeah.
what you're saying. Like we're losing people.
Right. Exactly. Why are we so focused on this? But I think some of what clouds that, and I put this post out too, is that women's hormones are having such a moment that you're getting so much noise from everywhere, like pharmacists, pelvic health physical therapists, health coaches, Beachbody people, people selling supplements are talking about women's hormones.
Yeah.
And so that I don't think helps, that everybody now all of a sudden is an expert in women's hormones. And the problem is it's never just about the hormones. And that's where I do go back to say you need people on your side that are conventionally trained, that have done the training and can recognize other things, because it's never just about that. You can't say someone has, I don't even want to throw out a lab value, but to make a diagnosis, you have to rule out other things.
Yeah.
And so you have to have a very comprehensive body of knowledge and how to critically think through a diagnosis. And so
Yeah.
that's the other part of, women doing their doctoring on Instagram is harmful.
I'm very worried about
So,
that. And I mean, I've been covering health for a long time. So sometimes I can tend to think, oh, I know more than the average person.
yeah.
But this
And you
summer I
probably
was,
do.
but this summer I had comeuppance because I was thinking, okay, I need to go into hormone therapy. I'm having all these digestive problems. They turned out to be actual problems that I needed to get sorted out. Like I had problems with my gut. If I am so grateful that I didn't go on hormone therapy, I'm grateful that I went and took the time to sort through the other problems, which do you think that happens where people think it's perimenopause or menopause and they go on hormones and maybe they should have got to the underlying problem?
Absolutely.
Okay.
100%. And part of that is a woman is not going to die from perimenopause
Right.
or menopause. That is just a state of aging that we're going through. But what happens to our bodies through that state of aging, and the things that are really going to hurt us, are the cardiovascular disease, the underlying cardiovascular disease, and the type 2 diabetes,
Yeah.
cancer, all of these other things. So if people are just going to say, a pellet place and going in and saying, I have these symptoms, I need, some pellets put in. And
Yeah.
they're dealing with someone who has no healthcare experience other than they trained how to put pellets in and they have a license. They're going to miss some stuff. And so that's what I think where we really need to focus on. HRT is one piece of the puzzle, but really that is our ticket to anti-aging. Not that we are anti-aging. So I'm not using that term as a construct. But if we want to slow down the effects of aging and chronic disease, that's where HRT comes in. But
Okay.
that's only one piece of the puzzle.
Right. Like you need to make
If that
sure
makes sense.
you need to
Yeah.
get checked out. You need to make sure that your chest,
Yes.
it's not just perimenopause chest pain.
Right.
You need to make sure it's not something else. Yeah.
Yes.
Yeah.
For example, bloating is very common in perimenopause and for
Yeah.
perimenopausal women. But, if I see a patient who's over 50 with new bloating, my first step is to make sure it's not ovarian cancer.
Yep.
A new symptom like that, you have to take very seriously. When we realize it's not anything life-threatening, then we kind of work our way back. And that's what I think is also missing. And if we weren't so polarizing and there wasn't this turf war going on, we could all work together and play on the playground together.
Yeah.
the care could get better.
Yeah.
And that's why. There's nothing wrong with, I think people can't say, I'm here, I made sure you don't have, ovarian cancer, but you may have some underlying GI issues I can't take care of. But who's really good at that?
Yeah.
This naturopath that, uses these other therapies. But that is not going to happen unless we start getting vulnerable, getting transparent, and putting people first.
Right. And not defending.
Yeah.
Defending turf. Okay, everyone always
Right.
asks about hormone therapy. What are you prescribing? What's happening right now? What's happening right now?
So I think actually hormone therapy is not as complicated as it comes off. I think that there is the FDA approved hormone therapy options, and then there's the compounded options. And to be very clear, here's one big takeaway. The FDA does have approved bioidentical hormone therapy. You can get bioidentical hormone therapy from Walgreens or whatever your pharmacy is. One example, go ahead.
Is that a patch?
Yep, the Vivel dot patch is bioidentical. So for me, I am very kind of picky with where I start with hormone therapy in women, and I will always choose a transdermal method and always bioidentical when possible, because the risk goes up for a blood clot when you take it orally, and it has to be metastasized or metabolized through the liver, and the first pass effect increases risk for a blood clot. So, and then oral micronized progesterone.
Progesterone is one of those things that is another controversial and interesting thing to me because, well, you need the progesterone to oppose the estrogen, right? Like you need the progesterone to oppose, but the progesterone itself does help. And I feel like it does have an effect, but I feel like it's one of those things that when you talk to a traditional doctor, they're kind of like, no, you just need to have the progesterone. When you talk to a naturopath and integrative people, they're like, no, progesterone's amazing. It actually helps on its own. Like, where are you with that? Do you notice
you absolutely need progesterone? I mean, need it for anything to live your life? No, but for symptoms, a micronized progesterone in and of itself has been shown to decrease hot flashes, and it helps women sleep. It's a natural anxiolytic. I mean, I call it nature's, like Ambien or Valium. It just works really well for women that have trouble sleeping. It helps them fall asleep and can also help stay asleep. So that's one example where, if someone's practicing and they're practicing what they learned 20 years ago about hormone replacement and they've not updated that body of knowledge, they're still prescribing a progestin, and progestins have crappy side effects. Women don't feel good on them. It can make their symptoms worse. They have mental health side effects. And so I don't ever use them.
Okay. So
for that reason,
progesterone, it's what our body makes as opposed to the synthetic progestin or
correct. And the trouble, right. And the trouble with progestin is that physiologically that compound can plug into other receptors. So it plugs into our progesterone receptors, but it can also plug into our testosterone receptors. It gets picked up in other areas. And that's why you see kind of some of those androgenic side effects with progestins, like acne or hair growth. They have a huge mental health side effect profile. They can cause some pretty significant depression in some women. So, and that's why IUDs are so nice, because they're progestin based. So they do a really good job of controlling bleeding. But very little of that hormone actually gets to those receptors. So the side effect profiles are lower. It's different in all women, but there is a huge difference between micronized progesterone or the FDA approved Prometrium, which is just a name brand of micronized progesterone, and 10 times the cost, is always going to be my preference. I hate progestins.
You hate progestins.
I hate progestins. Huh?
I hate them. Do you ever give progesterone alone?
Yeah, I give progesterone alone to perimenopausal women,
Okay.
specifically those that are still cycling,
Yeah.
that have, those more intense swings in the luteal phase from that unstable, that progesterone drops. And that's also where you get some of that estrogen dominance. Women that are perimenopausal, their periods get heavier, they can get closer together, their PMS symptoms get awful. The one thing is, it's not something that's done all the time, because a lot of women around that age group need contraception as well.
Right.
So sometimes, it's a delicate balance between making sure that they have the contraception that they need, because this is not a time for natural family planning. That's the other thing that drives me crazy. It's like, these people talking about natural family planning in any with PCOS, at any time. I'm sorry, it fails, and it fails a lot. And
Right.
so women, they should have the freedom to do it. But what I would always say to my patients is, how okay are you with an unplanned pregnancy right now? Because
Right.
if it happens, are you going to be okay with it? No matter what you choose,
Right.
you may have to deal with that. Whereas an IUD, it's, as effective as having your tubes tied.
Okay. Is that because we just don't know when we're ovulating, when we're having our periods? Or yeah, we just don't know.
Yeah, because the only thing you can track is the period that happens.
Yeah.
Then what happened 2 weeks before that, around, but when that's not predictable, women get pregnant in perimenopause accidentally more than any other group, more than teenagers.
Right.
Yep.
Right.
We feel safe. We feel like we know what's going on. And yeah.
Yikes. Okay. Testosterone. Tell me what you think. What's going on? What do you do with it?
So I think testosterone can be very helpful. I think that, I will tend to opt for more natural ways of increasing testosterone levels.
Oh.
So through weight bearing exercise, that's, adequate vitamin D levels. Those are two things you can do. I mean, weight bearing exercise can raise your testosterone level. And so I tend to do, more of that. But for women that, have more loss of muscle mass or libido, there's nothing wrong with doing a little bit of testosterone. I can tell you that the doctors that I worked with in the hospital 20 years ago, their wives were on testosterone. Their patients weren't, but their wives were.
Really?
Okay. Yep. Because of that, and it's in a cream, and I actually have it. I tried it because I was like, I want to try this and see what it's all about. And yeah, it's with that one, it's a balance of the side effects. And so that's the issue with like those testosterone pellets. I see more women complaining of hair loss with that, and they're not educated that could be a big part of, you put testosterone pellets in women. High testosterone causes female pattern hair loss.
Okay. And when you use testosterone, I'm so unaware. Do you rub it? Where do you do with it? Like, where do you, because I interviewed a nurse practitioner, and she said women rub it right on their, like right in.
Yeah, they can. Yeah. Yeah.
Wow.
Yeah. Yeah.
Wow. And that helps with the GSM, the genitoury syndrome of menopause.
Yeah, it can help more with sensitivity, but so can estrogen. So it's not, I do prescribe it, but not a ton.
Okay. You'd go estrogen first. You'd go estrogen.
Oh yeah. Yep. And then natural ways of raising testosterone. Yes.
That's amazing.
Due to the weak Wi-Fi signal.
Pardon?
Due to the weak Wi-Fi signal that we've talked about.
Yeah.
I only have 2 bars of service here. Help me out.
Sorry?
No, never mind.
I was thinking I'm out of it. I'm confused.
Okay. It's okay.
I'm also having a hot flash right now. I'm just getting really hot.
Okay.
Yeah. It's just, I'm getting a little bit glossy here.
You may have gotten a little flushed over the testosterone talk.
Yeah, probably. I probably will. I can't believe it hasn't been approved by the FDA, considering
right,
Viagra, etc. The only country that
Right.
testosterone is officially approved for use is Australia, I believe,
Hmm.
which means that's the
But
only
they're
country.
using it a lot in Europe too.
Okay.
I know they're using it. Hmm.
Yeah. Yeah.
And where do you get testosterone then? From the compounding pharmacy.
Right. The Wild
You have
West.
to. Yes, the meth lab on the corner with the windows busted out. That is inspected by the FDA and FDA certified. So
And Carmen, where do you suspect the suspicion that's the messaging about the compounding pharmacies is coming from? That's saying that they're so bad. How is that getting, where do you feel like that's coming
well, it's actually in the guidelines. The North American Menopause Society has it stated in their guidelines that they do not approve of compounded medication due to consistency, you know, in the dosing, in the concentration, just because it's unregulated. They're not
from?
saying that every compound pharmacy is bad, but you can't trust it. But that's where I was saying, I was just reading that article about how they are actually monitored by the FDA.
Right.
These pharmacies are. So it's not the Wild West.
Yeah.
And so that's where it comes from. People that are, following guidelines stringently
Right.
and, but at the same time, in actual practice, we use a lot of compounded medications, not just for perimenopause.
Have you ever seen the problems that they're warning about? Do you see that? Do you see a batch or a prescription causing an issue?
I have not had any problems with compounding pharmacies. Inconsistency. I've used a couple different pharmacies for my patients and things that I order. Some of them local, some of them mail order. You know, we have them on the corner. It's not like they're that hard to come by.
Okay.
I personally haven't seen those issues.
Okay. One of the other things I love that you talk about on social media is about endocrine disruptors and the products we use, the toxic, the cleaners, the chemicals that are in the products we put in our bodies and our perfumes and everything. This is another area where I feel like people think, well, it's regulated and those products wouldn't have dangerous chemicals in them because the government wouldn't let that happen. And then you can just tell me a little bit about, you make great posts about this.
Oh, well, it kind of goes along the same lines. I think that we like to think that our FDA is out to protect us and that our consumer laws and those, environmental protection laws have not been updated since the 1930s. I mean, talk about that's where the wild west problems are. I would like to start seeing doctors talking about that,
Right.
leaving the compounding pharmacies alone and talking about the things that are on our shelves that are making us sick. I mean, when you start digging in, the data is there. The Endocrine Society made a statement I think it was the first time in 2008, and they just updated it 10 years later. We know it's harmful. And they basically state we don't know to what extent because we don't have the study. Who's going to pay for the studies? Febreze? No, they're not going to pay for it. Who's going to pay for it? Unless we can sell a product, nobody's paying for it.
Right. Right.
And so, yeah, it's affecting us everything from, pregnancy to children, unborn babies, and to
Fertility.
menopause.
Yeah.
Fertility, absolutely.
Yeah. This is right in front of our face too, the fertility thing. Like it's, I mean, you can just look around at all the people you know who are doing IVF. This is like, it's.
Yeah. Yeah.
Yeah.
And I think some of it has to do with the stress of our modern world. And, stress, it's like a survival mechanism. Our body interprets stress as it's not a great time to get pregnant. So don't do it, and kind of shuts things down a little bit. But I do think we are really overlooking all these environmental factors, stress being only one of them, but also all of these things in our environment that mimic hormones. And one thing I noticed is applying, say, testosterone cream, you need a quarter of 1% testosterone cream on your skin for it to hit every receptor that it needs to for therapeutic outcome or side effects. You can get side effects from topical testosterone within 72 hours of putting it on, a quarter size. And here we're slathering Jergens, on our entire body.
Right.
It's definitely getting absorbed into the bloodstream. Yeah.
Right. We've heard of it.
And we have no idea what's in it. And why isn't anybody talking about that? Like, we're more worried about attacking other people and their health dogmas than we are about, the stuff that's all around us that's harmful.
So what would you, for the average perimenopausal woman, you've mentioned like, weight bearing exercise, what would you like them just at a basic, just to say, like, before you worry about hormone therapy, before you worry about anything, just in their lifestyle, what would be like 5 things you would say? Just please do these things for me and see what happens.
I think that all of those things can be based around lifestyle, and supplements even come secondary to that. So sleep is a big one. Decreasing stress is huge. Women need to decrease stress. And sometimes people are in relationships that cause them so much stress and anguish, or jobs that they hate. And this is where I get into that, kind of feminist outlook. Like, we need to be able to support ourselves so that if our relationship is stressful, we leave it. If our job is stressful, we can leave it. We're independent. We can make those decisions for our health. Weight bearing exercise. Yep. And staying active and avoiding sugar because of the things that happen with insulin resistance and erratic hormones.
Okay.
And
dechemicalizing, that seems like an overwhelming
thing.
Yes.
And cleaning up the environment. Yes. And that can be very overwhelming for people because sometimes it's not even what they're doing, it's the place that they live.
Yeah.
They live in a building that's 100 years old and it's full of chemicals in the walls. And how long did it take for us to determine that lead was causing developmental delay in children? A really long time.
Right.
And unfortunately, certain people are affected by that more than others because they're stuck in lead-based environments. And, so that's a kind of a government initiative. So that's what's hard, is that we can only do these small steps. So yes, definitely cleaning up the environment. Being very mindful about what you're putting on your skin and how much you're exposing yourself to it as well. There are sometimes things we need to do or want to do, but what is the frequency and amount? Right. Getting rid of all the plastic, not drinking out of plastic bottles, keeping an eye too on the news, the things that come out about it, the studies that come out about it. Is there some, they came out with all these, the initiative for the BPA free stuff came out. I want to say it was like 2014 was the first time I started, kind of crossed my desk as a clinician about BPA. Yeah. And I was telling my patients, BPA is the new lead. This is going to start coming at you. Next thing you know, we have BPA free water bottles. Well, guess what? Now there's a different compound in it that they think is harmful as BPA, but we have no studies on it. So we'll just keep drinking out of it
until someone studies it.
Until they decide, that it's not good. Yeah. It's frustrating because there's a lot of mixed information. And so I think those things are 80% of the battle, stress being a big one, and lifestyle for sure.
Yeah.
But the other takeaway is that I think there's always guilt that people try and put on women about treating their perimenopause and treating their mental health during that time. And that's why it's so important to have a good healthcare provider to rely on.
Okay.
Because I think what they're talking about, even in their friend groups, and what they do when they come to the doctor's office can be very different because of shame. For example, with antidepressants, there's a huge stigma around using antidepressants, to the point that it's the same with breastfeeding. Women just in complete and utter despair because they feel like they're not living up to the expectation.
Okay.
And so women that take, say, Zoloft for anxiety and depression, they're getting this message that you don't need to rely on medications. You just need to do these lifestyle things and join my 12-step program that I've laid out for you for, $800. Instead of, and that's why in one of these last posts I put, the modern woman does not, I can tell you, that's not what they want. They want to feel better so they can do their job,
Yep.
live their life, parent their kids, they can travel, not get a divorce, or, be able to do whatever because they feel like shit. And so that is one thing that gets my goat, is the shame around women treating their symptoms. It's like Instagram deciding what's acceptable and what isn't.
What would you tell women in perimenopause to look out for and just be like, beep, 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 back up when they see it on Instagram? What are the things that you're just like, oh my gosh, if I could cancel that person, I would. We're not going to cancel people, but what do you wish people would be? Because there's a lot of people out there.
I've been canceled.
I know.
I've been canceled.
I think I'm going to get.
Yeah.
Yeah.
A lot of people, you speak your mind, or you shine the spotlight on something people don't want to talk about.
Yeah.
Controversy will get you canceled.
You're really sticking.
That's okay.
It's okay.
Yeah.
It's okay. It might be relaxing. But
well, yeah, maybe. I can't say I haven't lost sleep over it a little bit, because I'm still a person. But if it has to be said, let's talk about it.
What bothers you though? What do you like? Gosh, I wish these people would leave Instagram, or what bothers you about the average woman seeing it?
I think it's the all or nothing. One is the shame, the big thing around shame. And like we talked about some of the physicians it's very black and white, and there is no alternative, and it's only guidelines. And it's just not that simple. It's not that simple in real life. And I feel like sometimes the motive behind that is not to educate women, it's to discredit other people. And so, and that's why I thought it was important to say, hey, Dutch testing is being presented at NAMS. They are coming to the conference and they're going to talk about it. And guess what? You might have been wrong when you said it was useless. You may have been wrong. And you just have never explored it, and you haven't read it, and this is up and coming. And instead of hating on everybody that's talking about it or doing it, I think one of the biggest faults with something like Dutch testing is that they made it available to anybody to do. And what happened was all these people with no qualifications or deep understanding of human medicine get their hands on it, and they make recommendations. And, because if not, there may be some really good quantitative data in those tests that we can use as clinicians when we're doing hormone replacement therapy. So I read through the studies. I'm still kind of in the mindset of, we make sure nothing else is going on and we treat the symptoms. But this is something that my mind is open to. I want to learn about it. If it's, new technology we can use. And so that's where I think this discrediting other people for the way that they're practicing, or, adopting new ways of doing things, I wish would stop.
Yeah, the Dutch tests are definitely, you'll see a doctor saying, if someone says a Dutch test to you, run away. This is not
right.
This is not approved.
They must be a quack. There's until it is approved, and then they'll be offering it,
and they're presenting it at NAMS. Yeah, and then they will be, and they'll quietly, they'll quietly not. They'll move on to something else. Sorry, I keep talking over you. They won't say, "Oh, I talked crap about this for 5 years on Instagram," and then one day quietly, just started doing it. That's how it works,
right?
Which is just so galling to see.
Yes, and that's I think what gets me triggered about people. They have this, and this is in real life medicine. They have a really hard time saying I was wrong.
Yeah.
Or I don't know. I actually don't know. Imagine that one person can't know every single thing. I had this professor at the George Washington University, and during my graduate school, and she said, the person that knows the most about something clinical is the last one that looked it up, because there's so much information. There's no possible way you can know everything about everything.
Right.
I mean, people, some of these people that are dogging, say, the Dutch test, they don't even know how to read one. They don't know, what, they haven't taken the time. It can simply be just a matter of time.
Right.
So to kind of explore it. It's not something I use regularly. And the reason is because I don't use it for my clinical decision making. So if I have patients that say I want a Dutch test, great, let's get one. This is how much it costs. It's not covered by insurance, and it's not going to change my clinical decision making. But if you want that data, let's get it and we'll interpret it. And that's where I think it's saying you can't say you can't have that. People like data, especially these younger women really like data. They
Right.
want to know.
We're measuring everything.
I think
we're measuring
right.
everything all day long, right? So
right. Yeah. So I think instead of saying the Dutch test is bad, people saying you have to have the Dutch test for them to make a clinical decision could be considered bad because they're expensive. It's not a cheap test. And a lot of times you don't need that test to do anything.
Okay.
In my opinion, for me.
And there are a lot of people becoming menopause coaches. This is a new growth area. And I think the idea of a menopause doula is an interesting one, because I think women are really busy and they don't have time to figure a lot of this stuff out. But I think what do you think? Do you think that it's problematic as well?
I think to have someone that's coaching you through, and an advocate. I mean, just to have an advocate is not a bad thing.
Yeah.
The problem is when these people overstep though.
Yeah.
And start, like I said, if someone's got symptoms and they say, well, these are all the symptoms of perimenopause and you have them. So let's do this A, B, and C treatment of, diet, exercise, and this and that. And the problem with that is you could miss something else more serious.
Right.
So I think, just like any other type of coach, you can't, coaching is coaching. They do not diagnose. They don't, period. And that is the biggest thing, is you cannot make a diagnosis that symptoms equal perimenopause. RNs, registered nurses, don't make medical diagnoses. It's a process. It's complicated. And that's where I think the biggest issue with that is if they are coming in and they're strictly just a coach, a life coach, a health coach, and they know how to work within those guidelines, I think it's great.
Okay.
I'm never going to turn down a coach.
I think what I'm taking away from you, and everyone should, is that, yes, we know there's dozens, and if not tens of dozens of symptoms for perimenopause, but you need to get to the bottom of what is going on to make sure that you're not just saying it's perimenopause. And that's not to scare anyone.
Right.
It's just, I know once you do that, like I had a cardio workup when I was like 44, because I woke up with chest pain, and I always was so glad about that, because I had the whole thing, and then I found out that it wasn't anything.
Right.
Why not?
Yeah, exactly.
Yeah.
I think getting that clean bill, people, but because of all this polarization, people are afraid. And that's the other thing I don't like. They're afraid of their conventional doctors.
Yeah.
Because of poor experiences they've had too.
Yeah.
And that's where I think talking about some of those, being more transparent to say, I am a doctor. This is a construct in which I work, and these are my limitations, and here's how I'm dealing with them. Yeah. But you will never hear them say that. And that's, I think, what's hard for people. They get confused. It's my way or the highway. This is how it is. Because the studies were done, and that's the guidelines, and that's the end of it. It's just not that simple.
Okay. Well, listen, thank you so much. Wits and Wellness on Instagram. Yeah. Fighting the good fight, getting triggered by
just talking about the things that need to get talked about. Yeah.
Did you enjoy the Instagram outage then? Were you like, I found it incredibly relaxing. I was like, well, okay.
I was like, if this goes for 6 months, I won't miss anything, but I'll have my piece back for a little bit.
Guess I can't put anything on Instagram.
Guess I can't. I'm not even going to look, I guess. Yeah.
Oh my gosh. Okay. Thank you so much. I appreciate it.
Oh yeah. Thank you. That was good.
Okay. That was good. I'm sorry. My cat was causing a ruckus. I've got to find.
Oh, it's fine.
Whatever. I will let you know. I'm getting all these together and putting them out. I've recorded about 13. So.
Okay.
Yeah.
Awesome.
It's good to talk to you.
Hopefully. Yeah, you too. Hopefully that gave you what you needed or wanted.
I don't know what I wanted. I just wanted to talk. I just love talking.
Yeah.
yeah, like I just love people who see things differently, you know, like just, it's not like this chorus of, I just love people who see the nuance, and that's not what social media is about. So
Yes, exactly. It's more about appearance. And the oh, what was I going to say? The word escaped me. See? Brain
see
fog. I probably need to change my HRT patch. I don't know, because I lose track of that too. That's probably what it is.
the brain fog. Today I had a really bad day because
Yes.
I didn't eat well on the weekend and I had some drink.
Oh,
And
yep.
today's just like, oh, it was just not good. Just can't organize myself out of a wet paper bag, as they say.
No. Isn't that amazing how I can lose a whole day just being like, I just feel like absolute garbage. I can't do anything. I
Yeah.
feel
And
terrible. I don't know what's wrong. I can't relate it to anything other than I exist. I'm 46. I don't know what the F is going on. Yeah.
yeah. And then I can write about it for everyone else and then just be the whole day just like talking shit to myself the whole day about the way this day's gone.
Yeah.
Just like, what is
Yeah.
wrong with you? You're such a freaking, and
What's
then
your
at night I'm
problem?
like,
Yeah.
what, you know, you know what this is. You know
Yes.
what it is. Like, why don't you be kind of nice to yourself? Like, you're writing about this all day long.
Well, yeah, I'm like, you know what? Why don't you get off your ass and do some weight bearing exercise? You haven't done that since you're telling everybody else to do it. You haven't done shit, and you feel like shit, and it's your fault. I mean, this is a pretty normal conversation. I feel like, yeah, I, had drinks on the weekend. I feel like
Yeah.
garbage.
Yeah.
I lied. The hair was curled 2 days ago. Yeah, that's all I can say. Thank God for this break in my employment. I'm on like a menopause sabbatical because I feel like shit.
You'll get back at it.
Yeah.
Yeah. And I'm working night and day, but like, and stressing out and
Right.
waking up at 4:30.
Yes. Yes. Oh gosh. And that's the thing. It's like one you get one thing in order, and then finally my mood starts turning around, and then I'm, waking up in the middle of the night.
Yeah. Yeah. Oh, it's fun. It's a
So,
ride. Okay. I just love
yeah.
talking to you. Let's keep in touch and
Yeah.
all
Okay.
of it.
For
All of
sure.
it. Thank
That
you.
was fun.
Okay.
Okay. Chat soon. Bye.